breast unit sessions. So here we can see one that is active, that it will have to be done. So if we go here, we see different patients that will be treated. They have not been evaluated yet. And here we will have the decision once it's done. So if we go to the session setup, we could include different assistants that will be into the breast unit. So we can edit the session and add or remove other assistants that will be there. And we will also have a list of patients that we can include for the breast unit session. So I will not go into the details here. We close this. And I would like to show you how is the evolution of for example, one patient. There are different scenarios for each breast cancer patient. So there is the diagnosis phase. There is a treatment between the diagnosis and the surgery. There is a surgery and after the surgery, and then the follow-up of that patient. Not necessarily all the patients will go through all the scenarios. It might go from diagnosis directly to surgery and so on. So this is an example of a patient, and here we can see all the data used for the decision-making process. So this is the typical information that the breast unit have for making a decision. And here we have, for example, the age of the patient, the family history, and so on. After, I would like to show you also more information. We have also the first visit. Here we have the lesion information, the pathology of that lesion, so that information for the lesion. And we see here that the decision taken for that patient is chemotherapy. So it has been evaluated in that session with chemotherapy. If we go to the next session for that patient, that is the 03, in the next breast unit, we see that it was after therapy, before surgery. So if we go here, because the decision was to do chemotherapy, here we will see what was the treatments given to that patient. In this case, we will see AC, that there are 4 cycles, another type of chemotherapy treatment with 12 cycles. So we go to the sessions, and yeah, maybe the best would be to see the full session. So we go again to the same patient. So the decision was to the surgery. So we can see after surgery what is the information, because there are several decisions for each step. So in each step, the breast unit will take a decision. So here we see that after the surgery, the breast unit have the pathology information. So before the surgery, maybe they have done a nuclear medicine test, and here we see that it's positive. And then the treatments for the surgery was a mastectomy, a sentinel node, and an implant insertion. And for the after the surgery, we can see the information, the sample for the breast. And this information, the breast unit and also the decision support system will use for supporting the clinicians to make a decision for further treatments after surgery. As you can see here, in the radiology, we have also the image information. So we can open the visualizer, and here we see what Ivan explained before. So we have the mammography, and here we will have also the tissue segmentation, and here we will see there will be other algorithms running to get other biomarkers for the decision-making process. If we go to the MRI, we can see a 3D image. So if we change here the brightness, we have different parameters that we can modify here. And clinicians could also see different images, and for them it's really important for making the decisions. Here you see a button, and this is because this is a session that it is running right now, so we can edit the information. So if we go, for example, to the patient file when they introduce the information, and if there is something wrong or if they want to modify or include something else, there is this information. So they here, for example, there is the risk factors. So if it is, for example, the genetic data, they can fill this information. They can also put the comorbidities of the patient, because that also influences a decision-making process. And we can see also the evolution of that patient. So for patient 03, we see the scenario A is for diagnosis, B is the after therapy, if there was any therapy, then after surgery, and the follow-up. So after surgery and the continuation. So here we can see easily what was the information of that patient. We could also see the mammography, and we can from here scroll or here and see what was the information. So we see here that a chemotherapy started, what was the treatment. Here also we can see the decisions. So here was decided to give a surgery. Here we can see that a nuclear medicine test was done. And here we see also the surgery, so which type of surgery was done on the patient. So this is the typical thing that we see in that, but I would like to show you also how the risk unit can make a decision. So if we go to another patient that has 70 years old, here we can see the lesion. If we do here edit, we can see also more information about the lesion. So here we see where it's located, it was already marked, and here we see more information about the lesion. And here in pathology as well, we will see the information for that lesion. So if we go to the decision-making process, we could choose which kind of source we want to know. So from which kind of guidelines, a priori, we want to get the recommendations. So here we can have local ONC means from Oncológica, which is a clinical partner that is involved, and these are local guidelines, but we could also use other guidelines or just one guideline. So we just will ask the system to give us which kind of treatment that patient should have in that diagnosis scenario. And but the clinicians, they may not want to follow this treatment given by the guideline, and we could say, okay, I want to give another treatment. But then the system wants to know if there is any criteria or reason for that. So we could say that, for example, the tumor size, it was difficult to follow up, because that could be the case sometimes before the surgery, because they don't know how is the tumor exactly, because the images are not clear and so on. So we do accept here, determine which kind of, here we will have a list of treatments that are stored into the system. So you could say, okay, we decided to give surgery to that patient, and this information will be stored into the system. So here we will see, okay, it was a surgery because the tumor size, difficult follow-up. This information we store into the system. So we submit the recommendation, and so on. And then you can see here that that patient was evaluated and a decision was taken, that is the surgery. If we go for another patient, in this case for the demo, we try to have a patient that is somehow a bit similar. So it's a patient with 64 years old. For the results are here a tumor, quadrants. Here also we can see the information of the lesion. And yeah, so here we can save, or just skip, cancel, and go into other information. So if we go to the decision-making process, we again may choose the same guideline. We ask, and of course we will get the same recommendation, but as before, we may think that, okay, no, I don't want to follow that guideline because it is also the tumor size difficult to follow up. And the system would will provide the treatment that was stored previously. Of course, this kind of decision or this will happen when this treatment has been somehow validated. So the clinicians could also choose, okay, this is the case, so I want to choose this one. Otherwise, we could say, no, I want another recommendation, and the system would keep learning. But we say, okay, let's have this one, and that is how the system will learn. So this is just a demo to show you how the system works.
Thank you very much. Thank you very much. I should say that software looks very, very good.
Thank you.
This is just